Today, let's talk about facial paralysis. And one of the most common cause of a lower motor neuron type of facial paralysis, meaning wherein the facial nerve itself is affected, would be called a Bell's palsy. That's one of the most common variety of facial paralysis. Apart from that, trauma does cause facial paralysis, especially the one involving the temporal bone. It can also be caused by tumors. It can also be caused when we operate on the tumors in that region around the brainstem, which causes compression of the 7th, 8th complex. But the good thing is, in most of these conditions, the recovery is really good, and we just need to take care of ourselves during that phase when the facial nerve is trying to recover. And today my talk is going to be exactly about that one very specific point. When there is facial paralysis, the muscles of the face, which is responsible for the movement on one side, is affected. So the movement on one side goes down, along with difficulty in chewing, containing the food inside, drooling of saliva. The other important organ which is affected would be the eye, and specifically the eyelid, which loses its ability to close itself completely. So what happens is there is incomplete closure of the eyes. And this talk is about this one specific point: care of the eye in a patient with a lower motor neuron type of facial paralysis. Now, imagine a scenario where you're traveling and there is a gust of wind. And what happens is our first response would be to close our eyes to protect dust from blowing into the eye. And a person with a facial nerve paralysis is unable to do precisely that. He's unable to shut his eyes properly, as a result of which it is exposed to trauma. That's one thing which you have to remember. Second is, imagine a glass of water which is kept in the open and a glass of water which is kept with the lid on top. The one which is kept in the open dries out quickly. So similarly over here, the eye is constantly open because the muscles around that is paralyzed. So as a result of it, the drying of the eye, there is irritation of the eye, there is a foreign body sensation which is caused because of. And if this is left unattended, it could lead to some serious damage to the cornea of the eye. And then by the time the 7th nerve comes back into action, you've already done the damage, and now you have to work towards undoing the damage which has been done as far as the eyes are concerned. So instead of that, what we need to do is try and prevent these things. And how exactly do we prevent this? These are very simple things. So what I've explained to you till now are the repercussions of not taking care of the eye. Now I'll tell you what all should be done to protect your eyes. First thing is, keep the eyes moist. So use artificial tears. So every hour or 2 hours, put those 2 drops into the eye so that there is adequate moisturization. And instead of the tears drying up, now you're providing some external tears so that dryness is prevented. Second would be, when you're traveling outside, as I explained to you, a gust of wind with some dust in it can cause trouble to you. So what you do is get glasses which are protective in nature. Transparent one with side cover would be excellent. So in spite of the eyes being open, it becomes much safer when you have these protective glasses. The third thing is, when you go to sleep. Now imagine a scenario where you've slept through the night with your eyes open. It would get dried, and by the time you wake up in the morning, there would be irritation of the eye, redness of the eye, and all those things that follow. So we have to be very careful when you go to sleep. So what we need to do, you can use simple paper tapes to just tape it over the eyelid. No need to go across also. The muscles are pretty weak, so all you need to do is put a tape over here and just leave it, and the eyes would stay closed through the night. In the morning, wetten it very nicely with water and gradually remove of that small little tape on top. Along with that, using a simple eye ointment would be useful in such cases, especially in the night. So these are the precautions that I really want you to take if you're suffering from facial paralysis. So protection of the eye, is in my mind the foremost in this, and I've explained to you the entire steps and why we are doing in detail. So you don't go into a situation where you're setting things right after it has gone wrong. Instead of that, prevention, as they say, is always better than cure. Thank you so much.